Yes, hello friends, good evening. And this is Dr. Tejas Prajapati, the faculty for forensic medicine on Nextillo. The wonder has a name. Yeah. So I would like to have a special thanks to Dr. Sunil Shah for providing this platform to us and for providing a very good, you can say, the faculties for different subjects. So dear friends, subscribe to the Nextillo channels and you can download the app also. We will give you the details later on. But today we are going to start a very important session, which is going to have an introduction to the forensic toxicology. So without much wasting time, we are going to start the session. So myself is Dr. Tejas Prajapati. I did my MBBS and MD and diploma in clinical toxicology from Australia, and I'm working in Gujarat at present as a consultant toxicology. So, dear friends, we are going to have as much as possible the interactions with you. If you have got any questions, doubts, suggestions, you can have put in a chat box, and we'll definitely have interaction. At the end of the sessions, we would also like to have some very good, you can say, the question for you people, so that you can have understand that what is going on, and we will also like to have a good answer from the students, so that we can acknowledge you on our websites also. So, dear friends, the students, what are the definitions with this toxicology? It's a science dealing with the properties, actions, toxicity, fatal dose, detection, estimation, interpretation of the result of toxicological analysis, and importantly, the management of poisons. It's a toxicology. Okay. It includes all the properties, actions, toxicity, fatal dose, fatal period, each and everything that comes under the toxicology. That's why that's known as toxicology. Forensic toxicology, it's a branch of forensic medicine which is dealing with the medical and legal aspects of the harmful effects of chemicals on human beings. And that's why it's called of forensic toxicology. And is a study and practice of application of toxicology to the purpose of law. Anytime we are doing and acquiring the knowledge of this forensic toxicology, the toxicology, then for the purpose of the law, in the court of law, honorable court law, so that will be considered as forensic toxicology. Another important definition for we have to understand is clinical toxicology, which is deals with the human diseases which is caused by or associated with abnormal exposures to the chemical substances, which is known as clinical toxicology. What is toxinology? Dear students, please concentrate on each and every definition, because I'm going to have a very important surprise question for all of you at the end of the session, and you will also get benefited to answer the questions. So just try to concentrate on the definitions. Toxinology refers to the toxins which is produced by living organisms which are dangerous to the man, like snake venom, fungal and bacterial toxins, etc. So that is known as toxinology. Ecotoxicology, again, that is all going to be very important definitions to understand. It is concerned with the toxic effects of chemicals and physical agents on living organisms, especially in populations and communities within defined populations. Okay, here we are using the term ecotoxicology within a defined population if the effect of such toxic effects or the chemical on physical agents on living organisms. So, way back in the 14th century, the Paracelsus, it's going to be very important, once said what he said and what is his interpretations, we would like to tell you. All substances are poisons. There is none which is not a poison. So how will you differentiate it? The right dose differentiates a poison from a remedy. So that's why we have to understand this very important definition of the important clarifications from the Paracelsus. So it is not easy to distinguish the toxic from the non-toxic substance, but the key principle in toxicology is, remember friends, this is a dose-response relationship. Just for an example, if I'm talking you and if you're taking a paracetamol tablets, if you're taking paracetamol tablets, 2 tablets or 4 tablets in a day, if you're increasing the dose, the paracetamol tablets, which is over-the-counter medications, which will be also turn out to be a toxic once you cross the therapeutic dose of paracetamol. So that's why the key principle in toxicology is dose-response relationship. Again, definition, the poisons. So what is poison? A poison is defined as a substance, whether it is solid, liquid, in a gaseous form, which if introduced into the living body in the form of either ingestion, injection, inhalation, or brought in contact with any part of thereof, will produce ill health or death by its constitutional or local effects or both. So that will be act or that will be defined as poison. So hopefully, dear friends, you got that important definition of poison, that is a substance which is a solid, liquid, or gaseous, which if introduced into the living body, ingestion, injection, inhalation, or brought in contact with any part of will produce ill health, death by its constitutional, local, or both the effects. That is a poisons. Like example, there are many poisons we don't know: the sulfur, sulfuric acid, arsenic, etc. Drug. Then what is drug? WHO 96, the refined drug, is any substance or product that is used or intended to be used to modify or explore the physiological systems or pathological states for the benefit of the recipient. This is going to why we introduce this. This is for benefit of recipients, and that's why that is going to be known as drugs, like paracetamol, as I told you, ciprofloxacin, salbutamol, or estrogen, etc. So now come to the very important slide here, that is sources of poisons. There are many sources of poisons. The first and foremost, the domestic or the household sources, because many times what will happen that what we have getting, it's a domestic or household sources. Second one is an agriculture or the horticulture sources, the people, the workers who are working into the farm, like a farmers, or the people who are working into this kind of farm. These are very important sources. Industrial exposures, the people who are working in the industries. Commercial sources, from uses as the drugs or the medicines overdose. Food and drink, food poisoning, you can say. Miscellaneous source like snake bites, city smoke, sewer gases, poisoning, lots many things that is going to be covered into this kind of source of poison. Domestic or household, like detergents, disinfectants, cleaning agents, antiseptics, insecticides, rodenticides. Here, the insecticides or rodenticides used for the domestic or household purpose, which is less toxic than the pesticides or insecticides, which is available into the market for the farmer preparations or you can see the field preparations. Agriculture and horticulture sources, like insecticides, pesticides, fungicides, weedicides, many agriculture products which may introduce. Industrial sources in factories where the poisons is manufactured, or poisonous or the chemical substances are byproducts. Commercial sources from the storehouses, distribution centers, and the selling shops. From the uses of drugs and medicines due to the wrong medications, over medications, and abuse of drugs. Dear friends, nowadays A drug of abuse is going to be a very common scenario, and we have to be very careful. Food and drink contaminations in a way of use of preservatives of food grains or other food materials, additives like coloring agents, odoring agents, or other ways of accidental contaminations of food and drink. So these are all the very important, you can say, the sources of poisoning. This is one of the most frequently reported poisonings and most frequent death by the poisoning. The most common in developing countries, still number one, is pesticides. So we have to understand these pesticides in detail in future. Next, household cosmetics, cough and cold remedies, plant scraps and insect bites, analgesics overdose, tropical creams and lotions. Sometimes accidentally the children may ingested it. Hydrocarbons, gasoline and kerosene that may be given. So manner of death by poisoning, again, that is going to be very important. Accidental poisoning cases are most, but the large number of deliberate or suicidal poisoning. Most common method of self-destruction: potassium cyanide, hydrochloric acid, opium barbiturates, OP, organophosphates, oleanders, etc. Corrosive agents, strong acid and alkali are used rarely because less painful substances are available. So that's not a good choice of corrosives. But homicides by the poisons is very rare nowadays. Such weapons of old-fashioned poisons such as an arsenic, strychnine, or cyanide are so easily detected that they are rarely used nowadays. So accidental poisons, yes, sometimes the children, the pediatric populations who are playing and sometimes are accidentally ingested something. Deliberate, many drugs, many chemicals they may have taken. Poisonings emergencies really been very critical. The household products implicated in most poisoning are cleaning solutions, fuels, medicines, other materials such as glue, cosmetics. Certain animals also secrete a xenobiotic poisons called venom, usually injected with a bite or the sting, and others animals harbor the infectious bacteria. So some other household plants are poisonous to the humans and the plants also. Anyone knows this is an online session. So if you can just make yourself comment that anyone knows about this plant poisons, which are the plants are very poisonous. Yes, anyone have got any idea about this plant poisons? Yeah, any I think any members can write it down here or in the chat box, or is there any facilities available to have interactions with you people? Yeah, anyone have gotten any idea about the plant poisons, what they have been aware about the plant poisons? I think you can write it down in a chat box or something so that we can have an idea. Is it like that? Is it possible? Okay, so I'm going ahead. Some of the household plants are very poisonous, and that can be also very important. So out of that household plants, now we will look for the types of poison. Acute poisoning. There are the two types of poisoning. One is an acute poisoning, one is an chronic. The acute caused by an excessive single dose or several doses of a poison taken over a short interval of time. That is an acute poison. Chronic poisoning, that means are caused by the smaller doses over the period of time, resulting in a gradual worsening of the people. So chronic may be arsenic, phosphorus, antimony, opium, etc. This is a chronic poison. So come to the types of poisons. The subacute poison also. The features of both an acute and chronic poison, which is a subacute one, and fulminant poisoning. That means produced by a massive dose. In this, the death occur rapidly, sometimes without preceding the symptoms. Also, if you're taking a massive dose of some poison, that will be a very fulminant. So another classification is also existing according to the site and mode of actions, and according to the motive or nature of use. So anyone have got any idea about the site and mode of actions classification? Yes, can anyone start writing in a chat box or something, or you can also answer. I don't know what will be the way of this. Is that possible to answer the question or interact with you people? Yeah, anyone can have in chat box. You can write it down in chat box. Any idea about this poison classification? Yes, any idea? If you have an idea, then we'll just have a share with you, or we can just go ahead. So we are going ahead according to the site and mode. So now the next one is a site and mode classification. Before that, I will just request you, all of you can download the app and use this helping hand coupon to avail app for 3 months at just ₹89. And this is what the Nextillo is doing. So this is just for a 1 minute slide. You can just look at the slides, and the tough times never last, but the medicos do. And that's why the Nextillo is wonder its name. And that's why they provide this very exclusive offer for the FMGE preparations and get this complete access to the Nextillo app for the 3 months at just ₹89. So friends, dear friends, install now and choose helping hand plan. Okay, any doubts about this app or something, you can just also contact us so we can have a more understanding for you. So now, classification. So what is the classification? The local classification that depends on local actions. Remote collections combine the local and remote actions. Okay, so what are these classifications on the site and the local actions? So that is corrosive. So corrosive, that means a strong acids. Okay, then we have the strong alkali, we have the metallic. The strong acid is mineral acid, H2SO4, HCl, HNO3. Organic acid, that is an oxalic acid, carbolic acid, acetic acid. Strong alkali, that is hydrates and carbonates of sodium, potassium, and this HNO3. Metallic will be the mercuric, zinc chloride, AgNO3, potassium cyanide, copper sulfate. Irritant, whether it is an agriculture irritant or the inorganic and organic irritant. In agriculture, we are having an inorganic, which is metallic, non-metallic, and mechanical. Inorganic, we are having a vegetable origins or the animal origins or chemical preparations. Another very important class of classification is cerebral. This is affecting the CNS. Cerebral, the stimulant, cerebral stimulants, which is known as cyclic antidepressants, amphetamine, or caffeine. Cerebral depressants, that is alcohol, opiate analgesics, hypnotics. Somniferous, that means it's sleep-inducing, opium and its alkaloids, barbiturates. Inebriant, intoxicated, which is an alcohol, ether, chloroform. Deliriant, which is datura, belladonna, hallucinogens, cannabis indica. Stupefacient, hallucinogenics, and convulsions also, which are the very important aspects. So classifications of poisons, intoxicated, which is according to this mode of actions and remote. The spinal poisons, which is convulsions, and we are having Stichinus nux formica for the spinal poisons. Peripheral nerves, we are having cocaine, procaine, and elections curare. Okay, then cardiac poisons are very, very dangerous sometimes. Potassium cyanide, sodium cyanide, digitalis, aconite. We are having an asphyxiants, asphyxiants, which is a carbon dioxide, CO, carbon monoxide, hydrogen sulfide, which is an H2S, which is very deadliest gas sometimes. We are having a nephrotoxic poisons, oxalic acid, mercury, cantharidis, hepatotoxic poisons, a phosphorus, a carbon tetrachloride, chloroform, and miscellaneous is a food poison. Okay, so dear friends, we can have another here. Do we have any understanding of this? Another classification is very important classification according to the motive or nature of classifications. So what is that classification according to the motive or nature classification? Can anyone have got any idea about this, motive or nature classification? What that should be included? What that should be included? Yes, anyone have got any idea about this? That what should be included? So that is homicide, suicide, accidental, abortifacient, stupefying agent, agent that used to cause bodily injury. Okay, cattle poisons used for malinjuring. So these are all the classifications which is used for according to the motive or nature of use. The most common which is used for the homicide purpose are arsenic, aconite, digitalis, Abrus precatorius, Titanus nexvomica. Suicide, if someone has to commit the suicide, which are the very important substances which can cause suicide? Opium, barbiturates, organophosphorus, then carbolic acids, copper sulfate. Accidental, maybe in aspirin injections, organophosphorus, copper sulfate. Snake bites, ergot, then carbon monoxide or dioxide, hydrogen sulfide. Still, there are many chemicals which have been used as an abortifacient, like ergot, quinine, caltropis, plumbagorosia, and many things. Still, many agents been used as stupefying agents like datura, cannabis, chlorohydrates, agents that may be used to cause bodily injury wrongly, that is like corrosives and alkali. Cattle poisons to kill the cattle, most commonly the Abrus precatorius and Calotropis plumbago. Used for malinjuring purpose, semicarpus anacardium, which is a totally wrong impressions that a person have got an injury. So that's why this is used semicarpus anacardium for malinjuring purpose. So now come to a very important aspect. I would just like to ask the students, do you have any idea about the ideal suicidal poisons? Anyone have got any idea? That a person have got an injury. So that's why this is used semicarpus anacardium for malinjuring. So now come to a very important aspect. Like, do you have any idea about the ideal suicidal poison? Anyone have got any idea? Yes, you can write it down in a chat box. Any person, and what is an ideal suicidal poisons? Yes, friends, you can write it down in a chat box. Ideal suicidal poisons. Anyone knows about the ideal suicidal poisons? So these are the criteria that should be cheap, easily available, no bad taste, cause no pain, highly toxic, okay, highly toxic, and tasteless or pleasant taste, capable of being mixed with the food or drink, which is an ideal homicidal poisons. So what are the ideal homicidal poisons? Which is cheap, easily available, colorless, fearless, odorless, so no one can recognize easily, highly toxic, no residual product taste, signs and symptoms resembles a natural disease, no antidotes, shows no postmortem changes, capable of being administered with the food or drink. So these are all the criteria which match up with the ideal homicidal poisons. Route of administrations, we are having a different route of administrations like oral, inhalations, parenteral, nasal orifices other than the mouth. Like sometimes the poisons may be inhaled with the nasal, rectal, vaginal, or the urethral route also. Sometimes the route of administration for any kind of toxicology or poison is maybe due to the ulcer, wounds, or an intact skin. So these are all the route of administrations that has been most commonly seen. Factors which is influencing the actions of a poison in the body. The quantity, definitely the quantity matter, physical form, chemical form, concentrations, condition of the stomach, whether it's just of any ulcer or any other problems. Route of administrations, if someone have inhaled, then that will be a more toxic. Someone have got ingestion, that will be a less comparatively this inhalation. Age, older people and the pediatric populations are more sensitive. State of the body health, a presence of disease, intoxication, arid poisoning states, sleep, that may be also affecting exercise, cumulative actions of poisons, tolerance, and idiosyncrasy definitely have got a role in poisoning in our body. So what are the symptoms and signs that may be very different from the different poisons and is responsible on the nature and action to the poisons? They can be local, remote, or combined, and or will be taught in individual poisons. So what are the common poisoning and drugs? As I told you, these are the pesticides, corrosives, irritant poisons, analgesics, hypnotics, tranquilizers, narcotic poisons, stimulants, excitements, convulsions, poisons, paralytic or anticholinergics and antihistamine poisons, gaseous and volatile poisons, industrial gases or volatile poisons, poisons by the plant, flora, or the fungi. Okay, so these are all their poisons and their symptoms, you can say, in a very basic manner. If you can see, arsenic can cause severe unexplained diarrhea, carbon monoxide, which is skin is bright cherry red in color. So these are all the just for an example of understanding of different poisons. Okay. Like food poisoning, metallic compounds, nicotine, opiates, oxalic acids, sodium fluoride, strychnine, so many things. So symptoms and signs are very important for any kind of poisons. Sometimes the poisoning is difficult. Okay. Sometimes the poisoning is very difficult to recognize, but the signs and symptoms may cause the doctor to think about the poison. They are, just for an example, sudden vomiting and diarrhea. Patient comes to the emergency, sudden vomiting and diarrhea. Again, we have to think of unexplained coma in children and adults known to have depressive illness, rapid onset of peripheral neuropathy, rapid onset of neurological or gastrointestinal illness in persons occupationally exposed to chemical, then we have to raise the suspicions. So now we will see the criteria, the diagnosis of poisoning in the living as well as in the dead person. So what are the importance of diagnosis for poisoning in the living? The history of the case as stated by the patient himself and his relatives of the friend. Full information about the time of onset, the present of illness and initial symptoms. Progress, relation with the food, condition over the other persons taking some food or drink. Then sources, a previous history of poisoning, a history of depression. Sometimes also note down the color, smell, consistency, taste, quantity of the possible poisonous substances. Symptoms and signs also we have to look after. The details of examinations, the preservation and laboratory investigations of vomitous excreta, stomach wash, scraps from any stains, area on the body, blood, stained parts of the clothes, contains of the doubtful container, left over and part of the food or drink. So this is all together a post-mortem, forensic toxicology. That suspected drug intoxication cases, sometimes on homicides, death due to the natural causes, motor vehicle fatalities, arson fire deaths, and many things. So how will you diagnosis of poisoning in a date? We till now understand a diagnosis in a living system. Now diagnosis in a case of date. How will you make diagnosis? History. We have to ask the history to the police or the relatives. History, 2 or more vital points. One, how long the victim survived after the initial symptoms. And second, any treatment been received previously to the PFC or CFC. Postmortem examinations after death, that is an external or internal examinations. The chemical analysis, detections of poisons in the body fluids, we have to do in after death. Preservation of viscera also another material for the lab, that is in forensic lab investigations point of view. Postmortem findings in a case of death due to the suspected poisoning, which are the postmortem findings? We have to go for the external findings or examinations to the internal findings or examination. So what are the external findings or examination? The postmortem stain, deep blue in case of asphyxiant poisons, bright red or cherry red in case of carbon monoxide or hydrogen cyanide poisoning. So the staining have what is its own important. Deep cyanosis with opium and cardiac most commonly. Early rigor mortis may be seen with the stitching and nux vomica. Early appearance of the sign of decomposition, mostly that has been happened with the H2S gas. And detectable smell in case of a volatile substance like opium, hydrogen cyanide, potassium cyanide, sodium cyanide, which may be very easy to detectable with the smell. This is just an example of postmortem hypostasis, and this is what the color changes may happen to the according to the level. External examinations, we have to understand under the skin and mucous membrane, which may be common in phosphorus poisoning. Ulcerations of the lips and near the angles of the mouth, that may be in corrosive poisons. Stain near the mouth and the hands, nitric acids and the copper sulfate. White froth from the mouth and nose, that is mostly likely the opioids and its alkaloids. Blood tinge froth from the mouth and nose, mostly that is of organophosphorus compounds. But this is all together required a big understanding and the reading material. Alopecia, hyperpigmentation, and hyperkeratosis, only the arsenic poisoning over the period of time. Staining, erosions, ulcerations near the female external genitalia, that is a use of hypercipient agents or the torturing agents, sometimes that may be opposite. Injection marks, mostly in a case of snake bites and otherwise may be seen. Then what will be the internal findings in case of suspected poisoning? The GIT boldly carefully, since corrosive and irritants will be there. The signs of hyperemia, softening of the skin, ulcerations and perforations. So that is good for them. Another internal findings is corrosions, ulcerations and desquamations, inner aspects of leaf, and that is of corrosives. Alkali, you can also say. Hardening of the mucous membrane, which is going to be seen in phenol poisoning. Phenol yellowish discoloration, that is due to the nitric acids. Bluish discoloration, that most commonly in copper sulfate and in our industrial chemical exposures. Carbonizations and the charring concentration sulfuric acid, that has been seen. Chalky appearance consistent with the teeth, which is commonly seen in sulfuric acid. Blue line of the gum may seen in chronic late poisoning. Swollen gum, loose teeth, fetid smell, phosphorus poisoning. Corrosions, irritations, desquamations, and hemorrhage, most commonly seen in esophagus, corrosives, and irritants. That is hardening and white discoloration, that is common in carbolic acids. Discoloration and staining of the inner aspect of the mouth with color poisons. maybe possibilities. Anesophageal stricture, most commonly a complications of sulfuric acid. What the study about showing into the stomach? Again, that is a thickening, softening, hard wall with the carbolic acid, hard and leathery with the formaldehyde. Otherwise, the hyperemia, hemorrhage, disclamations of the mucous membrane due to the irritation, sloughing formations, and maybe sometimes a nails have got discolorations with bluish with the CSO4 and slate gray with the HgCl3. Stomach contains again a blood, yellowish is HNO3 and bluish with will be the, and small intestine may show eruption, sometimes may show presence of poisonous remain. Large intestine again, that is an HgCl3, which is most commonly seen. Liver, different degenerative changes in the liver, type and extent of degenerative changes depending on the type of poisons, dose, derivation, physical condition of the patient. Kidneys again, that has been reported, shows that is swollen, reddish, soft, sometimes greasy, touch with that hemorrhage in the cycles and the other degenerative changes. Urinary bladder, hemorrhage in the cases of Abrus, Viper, and cathartics poisoning. So larynx and trachea may also be having hyperemic inflamm in case of inhalation of irritating gases leaking, to the corrosive agents like ingestion, vomiting. Throat, that may be in the human of trachea, and larynx case of OPMM or organopoisonous poisoning. Another one is the chest cavity, smell, lungs also we have to see whether it is in vomitous or congested, heart also the similar way. Brain, spinal cord again have congestions and edema. Brain may be congested and edematous. Uterus and vagina again that may shows a staining or congestion, hemorrhage or ulcerations. So which are the very important specimens? Can anyone tell me which are the specimens must have to be collected at the time of this post-mortem examination? Please, can anyone have a chat box? Anyone can have a chat box. Which are the common element? You can say the post-mortem samples must have to be collected. Yes, anyone? Okay, so these are the very important specimens like blood from the heart. Then we have the vitreous humor, we have urine, bile, liver, other like lungs, spleen, stomach contents, or the brain. Okay. So approximately 50 to 100 ml of blood, otherwise all the things like the similar. Like in urine test also, few drops of urine also only required, and saliva testing they are doing also. And hair testing from the hair analysis, that is also a very good and important aspect. So I think we will see the hair analysis on the next time. But till now, do we have any questions, doubts, suggestions? You just have, I will just check it out with the chat box. Can anyone have any idea? Any suggestions till now? Yeah, any now still suggestions or questions, doubts? Please drop a message to the chat box. Anyone have any idea or suggestions? Yes, any questions? No? Okay. So we have to preservation of viscera, stomach, some portions of the spleen, sample of the blood. This is some of the sample collections. Okay. Blood, urine, both the lungs, heart, in case of cardiac poisons. Spinal, in case of spinal, bones, in case of arsenic and lead, hair in arsenic or copper, nails, skin scab, you can also stain areas of the dress. These are all these things which must have to be collected and sent to the forensic science laboratory. Which are the preservatives used for the viscera? Saturated salt of solutions, absolute alcohol, rectified spirit is going to be used for this preservation. Okay. and urine also must have to be preserved for this preservations. So what are the management of case of poisoning? Anyone have got any idea, or we should? I think till now I just want to ask you, till now, if you got any questions, doubts, suggestions, please let me know in chat box, please. After that, we will see the management of a case of poisoning. Yeah, anyone have got any questions, doubts, suggestions till now? No? Okay, so we go ahead. So immediate resuscitative measures, basic managements, that is ABC, must have to understand air breathing and circulations. So we have to cleaning the airways, we have to supplement the oxygens and IV fluids, administration must have to be given. Depressions of CNS should be corrected. So removal of patient from the source of exposures, removal of the unabsorbed poisons, diluting the poisons, elimination of absorbed poison, use of specific antidotes and symptomatic management. This is a specific management goals. Okay. Specific management must have to be removal of patient from the source of exposures. We have removal of the unabsorbed poisons, washing the affected part of soap, water with a gentle rubbing will be helpful. In case of ingested poisons, we have to go for the gastric lavage, emesis. In case of an injected poisons, ligature is applied over the wound, which is nowadays not such common. In such cases of inhaled poisons, must have to be removed to the fresh air. Okay. So gastric lavage is a very good and important technique. We all must have to be understand. Here, this is a lavage tube, endotracheal tube or intubations tube, which may be considered sometimes. This is a tube, this is a OAS tube, and the other one is a Ryle's tube. So how will you insert? You can just see from nose to the epigastric region must have to be reach this kind of Ryle's tube. Okay, so this is the Ryle, the understanding going. Okay, and this is some of the hopefully that you all people can see this video also, and this is the Ryle's tube going from nose to the gastric lavage, from the gastric, and that must have to be confirmed. Okay, this is a nasogastric tube for the nasogastric lavage. After that, we can just expirate the contents and put in on litmus paper to confirm whether it is an acidic or basic. We can also ask the patients to have just take him to take a deep breath and swallow the saliva, and after that, that is a proper technique to insert the Ryle's tube. Then how will you confirm the Ryle's tube? That is that you have to put a stethoscope on epigastric region and just connected that with the you can say the empty syringe, and you just have to hear the sound of the air into the epigastric region. So if it is there, then that will be confirmed the person have inserted the Ryle's tube on a right directions. Another confirmatory diagnosis is just to have to aspirate the contents from the Ryle's tube. Hopefully all of you can see the aspirations of contents, and after that, that is also confirmation. So contraindications of Ryle's tube: it's insignificant overdose, corrosives. We are not going to hydrocarbon ingestions if the person is not conscious very enough. Complications may happen with the aspiration pneumonia or a laryngeal trauma, esophagus, you can say the perforation, epistaxis, or electrolyte imbalance may be there. Specific is removal of patient from the source of exposures, removal of the unabsorbed poisons with the washing of affected area. With the ingested poisons, we have to go for the diluting the poisons for the delayed or elimination of absorbed poisons with the urinations, with the diuresis, diaphoresis, dialysis, or some chelating agents. Use of specific antidote also, we are going to use a specific antidote if it is required. Symptomatic treatment also, safeguarding respiration or maintenance of the circulations. Antidotes also, we are going to use many a times an antidotes like substances which are the counteract the effect of poisons. And we have to give this antidotes in a specific chemical exposures to counteract the effect of poisons. So what are this? They divided into the mechanical, physical antidotes, chemical antidotes, physiological antidotes, or specific receptor antagonist. So we have to understand these four important antidotes also: mechanical, chemical, physiological, or specific receptor antagonist. So physical or mechanical antidote prevents an action of poisons mechanically. Example, without destroying or inactivating the damaging actions of the poisons. Okay. So example is adsorbents like activated charcoal. Emulsions like albumin, starch, or milk. Okay. Diluents like water, milk, or bulky food like boiled rice or vegetable. These are all the physical or mechanical antidotes. Okay. Chemical antidotes. These are the substances which disintegrate and inactivate poisons by undergoing the chemical reactions with them. And that's why the weak acids for alkali or common salt or albumin, these are all the chemical antidotes. Caminophore, potassium permanganate, very, very famous. Physiological antidotes. So they have their own actions producing the signs and symptoms opposite to that produced for the poisons. Naloxone for morphine, then neostigmine for datura or hyoscine group, barbiturates for strychnine. These are the physiological antidotes. Snake bites, these are again a very commonest scenario of snake bites, what we are also understand for this snake bites. Serological antidotes, which is available for the snake bites, anti-snake venom, or the serum for snake bites poisoning. Which is again a very common terminology used as universal antidotes. It's a combination of physical or chemical antidotes. When the exact nature of poison is not known, the universal antidote is used, which acts against a wide range of poisons, which constitutes activated charcoal 2 parts, magnesium oxides 1 part, tannic acid 1 part, and dose is 1 teaspoonful, 15 grams, you can say, in a glass of water. Can be repeated also. Activated charcoal for its adsorbent actions, magnesium oxide neutralizes the acids of poisons. Okay, so this is an universal antidotes. Household antidotes, again a strong liquid tea sometimes contain tannic acid, which will maybe precipitate alkaloids and metallic poisons. Starch for iodine, then milk and raw egg for the mercury, arsenic, and heavy metals. Flour, suspensions, and mashed potatoes can be used sometimes in place of activated charcoal. Milk of magnesia or soap solutions for the acid poisoning. Orange, lemon juice, or vinegar for alkali poisoning also we can use. So in short, these are all the household activities which can be used for used as an household remedies. Chelating agents, again, are very important. These are the substances which act on absorb metallic poisons, have greater affinity for the metals as compared to the endogenous enzymes. The complex of agents and metal is more water soluble than the metal itself, and that's why they're resulting in a higher excretion of the complex. So what are the chelating agents that you know? British antileviside, that is a BAL or dimercaprol. Then we are having an EDTA, ethylene diamine acetic acid, penicillamine, that is cuprimine, desferoxamine. These are all the chelating agents what we know. Duties of registered medical practitioner in connections with the poisoning cases, very important. Try to save the life. That is the most important duty. If necessary, that should be sent for the better hospital. If possible, the government hospital. Condition demands and permits the shifts. Take a detailed history, symptoms started, what was the progress related to taking any food or drink, or the number of sufferer more than one, or whether the treatment was already been given outside. The doctor should himself record the history of the case, signs and symptoms of the progress, and the doctor should collect and preserve the vomit, stool, urine, clothes, stain, whatever that is available in case of the arrange a reliable attendant to the choice. Inform the police station irrespective of survive if the date, then arrangement for recording the dying declarations must have to be made. If the death happened, death certificate should mention about the poisoning, suspected poisoning, and always recommended for the post-mortem examinations. These are some of the medical legal aspects of poisons. 85 IPC, that is dealing with the criminal act under the involuntary intoxications, and 276, 277, and 278 also. So I think the 326 is a person gives of otherwise administer a stupefying or intoxicating a unlawful agents. So dear friends, this is altogether your first session on introduction of forensic toxicology. Now it's a time for your surprise question. So all of you ready? So my question to all of you, if you can just listen carefully, what is the ideal preservative in a case of suspected poisoning in a post-mortem examination? You can just write an answer in a chat box. The first one give the right answer will be benefited from the Nextillo. Yes, please, students, just write it down in your chat box. Which is the ideal preservative used for preservation of viscera in a case of post-mortem examination? First, students, you just write it down in your chat box. I will read it out. If some first person will be there, they will be benefited with the Nextillo. Yes, any students? Any students? Yes, anyone knows which is an ideal preservatives for? Yes. Which is an ideal preservative? Yes, so I think we got one answer from the Mudit Soni, who will write it down, the spirit. Yes, so the Mudit, I think you are ideal preservative for, write it down, is spirit, you can say, or 99.9% alcohol, which is an ideal. So you are right. We are normally using a saturated salt of normal saline, which is most commonly used, but the ideal preservative is you can say the 99.9% alcohol, or you can say the spirit. So congratulations, Mudit, you got your gift very soon from the Nextillo. So dear friends, thanks for your attentions for today's sessions, and hopefully that you enjoyed a lot with understanding of forensic medicine and toxicology from introductions point of view. So hopefully, dear students, we will having a more fun while having understanding forensic medicine and toxicology in future. Subscribe Nextillo for our next few classes, and you will definitely get benefited from Nextillo. So thank you so much, students, for your kind attentions. Thank you.